If there is one thing that stops people from booking a hair transplant, it isn't the cost or the result. It is the fear of pain. People picture hundreds of needles, hours of agony, a brutal recovery. The reality is almost the opposite, and we can prove it with numbers, not promises. In this video, we'll walk you through exactly what you feel at every stage, during the anesthesia, during the surgery, and through the days afterwards. We'll compare the techniques, look at what a study of nearly 20,000 of our patients actually measured, and tell you the one thing that generally can go wrong. Let's start with the questions. Transplant is mild and short-lived in terms of pain. Most of it lands in just 2 moments. The local anesthesia injection at the start and the first 1 to 2 nights afterwards. Everything in between is essentially painless. Once your scalp is numb, you don't feel cutting or extraction. You feel the pressure, vibration, and the sound of the room. In our patient data, 92% rate their overall discomfort at 3 out of 10 or lower. The mistake people make is assuming painless means no sensation at all. It doesn't. You'll feel things, but it just won't hurt. Yes, you're fully awake and conscious the entire time. A hair transplant is done under local anesthesia, not general anesthesia, so your scalp is numb while the rest of you is completely normal. Most people listen to music, watch something, chat with the team, or even nap. There is no breathing tube, no going under, no grogginess afterward. That alone removes a huge layer of risk and recovery time compared to procedures done under general anesthesia. The most painful part is the administration of the local anesthesia, and even that is brief. Most patients with the injection staying at 3 to 4 out of 10. Roughly the same as a dental numbing shot or a vaccine. Here's a detail most clinics don't explain. The sting isn't really about the needle, it's about nerve density. The frontal hairline has far more sensory nerve ending than the donor area at the back. So the front feels sharper, even with the exact same needle and the same anesthetic. In our patient survey, 78% named this injection phase as the single most uncomfortable step of the whole day. Once the anesthetic spread through the tissue, the rest of the procedure is effectively pain-free. Post-procedure pain is mild and fades fast. For most people, it's gone or nearly gone by day 3. Soreness shows up mostly in the donor area at the back of the scalp, peaks within the first 48 to 72 hours, and then drops off quickly. The number back this up. 85% of patients stop taking any painkillers within 48 hours, and fewer than 5% report meaningful discomfort beyond day 3. Standard over-the-counter relief like ibuprofen handles it. Alongside the soreness, expect some swelling on the forehead, peaking around day 2 or 3, and clearing by day 4 or 5. Plus, itching as the scalp heals, typically between day 4 and 14. The itching is a sign of healing. Scratching is the one thing you must not do, and we'll come back to why. FUE-based techniques are the least painful, and FUT is the most painful, and the gap is real. The difference comes down to whether tissue is cut and stitched or not. Here's the honest breakdown from Gentle Stuff. At the very bottom of the pain scale is our Vector 10 method, the CVD lab-grown diamond tip we developed with Epsilon. It's so sharp and the diamond surface is so hydrophobic that it glides through the scalp with almost no drag. We had a patient recently ask, "So when are we going to start?" And the procedure was already finished. With Sapphire FUE, the scalp is numb and comfortable, but you still feel a faint sensation. With Vector 10, the patient felt nothing at all. Sapphire FUE and Micro FUE come next, around 1 to 2 out of 10, with tiny incision and fast healing. Standard FUE is close behind, with mild donor soreness for 1 to 3 days. DHI runs slightly higher, around 3 to 5 out of 10 for the first couple of days, because the implanter pen places grafts under repeated pressure in the reception area. FUT is the outlier, 4 to 6 out of 10 for 3 to 5 days, sometimes up to 8 because a strip of scalp is removed and closed with sutures. That's a wound under tension, not tiny punctures. If comfort is your priority, a lab-grown diamond tipped or a sapphire method is the way to go. Yes, and we have the data to show it. At Vera Clinic, we ran a retrospective study on 19,586 of our own FUE patients treated between 2021 and 2025, comparing traditional needle anesthesia against needle-free pneumatic anesthesia, which numbs the scalp using high-pressure jet delivery instead of a needle. The findings are striking on two levels. First, fear. Both groups walked in expecting above 7 out of 10. Both were dramatically wrong about how much it would hurt. With traditional needle anesthesia, actual pain came in at 3.8 out of 10, already far below what people feared. With needle-free anesthesia, actual pain dropped to 1.7 out of 10, less than a quarter of what those patients anticipated. The difference between the two methods held up even after accounting for age, graft count, and degree of hair loss. The takeaway is simple. The step everyone dreads is the step we've made the most comfortable. And the pain you imagine is almost always worse than the pain you'll feel. We also use vibration anesthesia, which can cut injection discomfort by up to 60% for needle-anxious patients. Pain after a transplant is mild, but how you manage the first few days make a real difference. The biggest wins are simple and worth doing exactly as instructed. Take your prescribed painkillers, paracetamol or ibuprofen, on schedule rather than waiting for pain to build. Sleep with your head elevated at 30 to 45 degrees for the first few nights to limit swelling and pressure. Apply cold compresses to the forehead only, never to the grafted area. Skip alcohol and smoking for at least 7 to 10 days, since both slow healing and increase soreness. And when the itching starts around day 4 or 5, use a saline spray or a clinic-approved foam. Do not scratch. Done right, most people are comfortable within a couple of days. Pain that gradually fades is normal. Pain that gets worse instead of better is the warning sign. And it should be checked, not waited out. One reassuring fact: pain itself doesn't damage your result. Graft survival isn't harmed by soreness. It's harmed by behavior like scratching or pressing on the grafts on the first 72 hours before the follicles have anchored. So the rule is manage the discomfort, protect the grafts, and flag anything that escalates. So the honest answer is this: a hair transplant involves a few minutes of sting and a couple of nights of mild soreness, and almost nothing in between. The fear is consistently bigger than the experience, and now you've seen that measured across nearly 20,000 cases. At Vera Clinic, with over 13 years and 40,000 patients behind us, reducing that discomfort isn't an afterthought. It's built into the procedure through needle-free and vibration anesthesia and a recovery protocol designed around your comfort. If you're waiting a transplant and the pain is what's holding you back, that's exactly the conversation our medical team is here for. Book a free consultation, send us your photos, and we'll tell you honestly what to expect. If this clears things up, subscribe. We break down one real hair restoration question like this every week.